Social entrepreneurs don't generally set out to incite protests or topple despots, but they are revolutionaries nonetheless. They understand that wars can be waged by 1,000 cuts, that crimes against humanity occur when millions of children die of diarrhea or tetanus, when medicine fails the poor, when education squanders young educators and sacrifices its young. And they refuse to accept that this is reality, the status quo, just the way things are. They know better, and they set out to make it so. The 2011 Skoll Award winners we honor tonight offer scalable, proven solutions to these toughest of problems and to the unacceptable conditions of poverty and injustice that breed and sustain them. Jeff, will you please join me on stage for our awards presentation? First up, Rebecca Onie, Health Leads. Rebecca Onie recognized the compounding effects of poverty on illness, designed a protocol, and set about to cure a sick system. With Dr. Barry Zuckerman of Boston Medical College, Rebecca founded Health Leads to bridge the health gap between medicine and social work. Health Leads expands the capacity of clinics and hospitals to meet the underlying needs of poor patients. Doctors prescribe support services along with medication, and Health Leads volunteers connect patients to sources of food, housing, job training. In other words, to sources that can accelerate their healing and keep them healthy. Within 90 days, the majority of patients served by Health Leads have secured at least one essential resource, and 83% of its volunteer graduates have gone on to jobs or advanced study in the fields of health and poverty. Rebecca Onie, Health Leads.
In October of 1995, I walked into the waiting room of a chaotic, busy urban clinic. The TV, I distinctly remember, played this endless reel of cartoons, and the exhaustion of mothers who had taken 2, 3, and sometimes 4 buses to bring their children to the doctor was palpable. The doctors, it seemed, never really had time for all the patients. And over the course of 6 months, I would corner them while they were scrawling notes in the medical record or swallowing their lunches in the hallway. And I would say to them, if you had unlimited resources, what is the one thing you would give your patients? And they said the same thing again and again and again, a story we have now heard hundreds of times. They said, every day we have patients who come into the clinic, child has an infection, and we give the family medicine. But the truth is, I know there's no food at home. The truth is, I know this family is living with 13 other people in 2 bedrooms, and I don't even ask about those issues because there is nothing that I can do. On those issues, we practice a don't ask, don't tell policy. And in fact, in that clinic, it is true. The patients pile up in the waiting room, the doctors have just a few minutes, and they would say, I don't know where to find food for the patients, and I have no help in doing so. In that clinic, there is 1 social worker for 24,000 patients. This clinic, to be clear, is not in Lima, it is not in Nairobi, it is not in Bogota, and it is not in Port-au-Prince. It is in Boston, Massachusetts, in the shadow of Harvard Medical School, the epicenter of some of the fanciest and most expensive healthcare in the world. And indeed, in cities across the country, in Harlem, New York, Southeast Washington, D.C., the South Side of Chicago, and other clinics throughout the country, this is the way healthcare is delivered. And it shows. In the communities where Health Leads works in Baltimore, Maryland, the life expectancy is lower than it is in Bangladesh. So let me be plain here. The impact of poverty on health is not a developing world issue. It is not a developed world challenge. It is a challenge that is faced by poor people everywhere they live in the world. Health Leads' response is simple, it is cheap, it is effective. We enable physicians to write prescriptions for basic resources like food, housing, and heat, alongside prescriptions for medication. Patients then take those prescriptions to our desks in the clinic waiting room, where we have a core of 700 college volunteers who fill those prescriptions by connecting patients out to the resources that they need. Over the next 3 years, Health Leads will create 25,000 successful resource connections for low-income patients and their families. But our goal is not merely to serve more patients. The goal is to change the way that healthcare is delivered so that doctors can prescribe solutions that improve health, just as they prescribe prescriptions that will enable families to manage disease. This is our vision, and this is why the Skoll Award is so important. Health Leads' model is a distinctly non-innovative approach. The purpose of the award is to allow us to follow in the footsteps of and to learn from Paul Farmer, Vera Cordero, Jean Falk, Mitch Besser, and so many others in this room who share our vision for the way that healthcare should be delivered everywhere across the globe. What Health Leads has been able to show is that if you put a couple of volunteers in a clinic waiting room, you empower physicians to ask the real questions of their patients, and you create a next generation of frontline healthcare providers and leaders who really will change the healthcare system. A couple of weeks ago, I had the chance to talk to Mia Lozada, one of our alumni, who's now a medical school student and spent 3 years as an undergraduate working in that same clinic at Boston Medical Center. She said, "When my classmates write a prescription, they think their work is done. When I write a prescription, I think, can the family read the prescription? Does the family have transportation to the pharmacy? Do they have money to pay for the prescription? And do they have food to take with it?" Those are not questions that I learned in medical school. Those are questions that I learned with Health Leads. Thank you.
Moir, New Teacher Center. In the U.S., 1/3 of our new teachers, young men and women entering a noble profession with noble aspirations, don't make it. The turnover rate saps education of its talent and scars schools, classrooms, and students. Even worse, the problem hits the most vulnerable the hardest, since new teachers are most commonly placed in the toughest school settings. Ellen Moir traces her passion for education to her high school Spanish teacher, who encouraged her to become the first one in her family to attend college. For more than 20 years, Ellen has tested and refined a model to pair talented and experienced veteran teachers with talented and inexperienced new teachers, launching New Teacher Center in 1998. In 2010, the center reached more than 26,000 teachers to affect 1.84 million students. To bolster its impact, the center plays an active role in the national education policy debate, advocating for state and federal policies that line up with the needs of educators and students. Ellen Moir, New Teacher Center.
My first year as a classroom teacher, I felt like a complete failure. I wanted to quit. I'd never worked so hard in my life, and I knew in my heart that I really wasn't making a difference in the lives of my students. From the moment I left college, I knew I was going to be a phenomenal teacher. But when I met my students, I could see quickly that I didn't know what to do. Maybe I'd chosen the wrong profession. Those are the words of new teachers across America. We have a horrible way of inducting them. It's really a trial by fire experience, one that you'd never want to happen to anyone you know. Yes, we can find a key for them to the classroom, but the room is bare. There's nothing for them to know, a guide on what to teach or how to teach. And they're disproportionately assigned to the toughest schools, and within schools, the toughest assignments. No wonder 50% leave within the first 3 to 5 years. And let me be clear, those that leave are leaving from the communities and from the students that need stability and connectedness the most. It's a tragedy, it's despicable, and it haunted me for years to watch this play out as we simultaneously talked about building a profession. How could we ever really recruit the most talented to stay and care and do their best if we greet them with the conditions that we've done so far? At the new Teacher Center, we're driven to build a better profession, to really honor and value teachers. Each of you remembers a teacher that made a difference in your life. I personally want to be sure that it's not left to chance that every underprivileged child in America, every Latino and African American child in this country gets the best teachers. So we built a model to actually onboard or induct new teachers into the profession, where we not only wanted to help new teachers and their students, but we wanted to create optimism and hope in our profession by releasing the most talented of teachers to serve in the role of mentor. And these exemplary teachers, they teach new teachers how to teach. That's their job. They're beside the new teachers every week of the year for 2 years. So if a new teacher has a problem and it's 8 p.m. at night, they can ping them and get an answer, or they can simply pick up the phone. Let me tell you a moment about Viviana Espinosa. Viviana teaches in East Palo Alto. Many of you have heard of Palo Alto, probably one of the most affluent communities in America. But have you heard that East Palo Alto, across the bridge, resembles the south side of Chicago, the Englewood community? It's tough. I remember when I went there the first time, 10 years ago, I couldn't believe that we called this a school and a district. Against all odds, Viviana, with her 20 first graders, those 20 students of 17 were English language learners. Viviana set out an aggressive course with her mentor to help every single one of those students read at grade level by the end. And I'm happy to tell you that with this expert other at her side, Viviana was able to do just that. 15 of the students met grade level, and all 20 of them had made growth beyond a year. I tell you that story about Viviana because you can see that her students are really the primary beneficiaries of this work, but I want you to know that Viviana's mentor and the other mentors that we've reached across the country, 6,000 of them, for the first time in their careers, feel empowered and proud to be teachers and are very focused on how to build in this continuous improvement process into the schools. We reached 1.5 million students. I'm proud of that, but that's not enough. With this Skoll Award, we're going to double that number. We're going to reach 3 million new students coming from communities where they're underserved and not getting the kind of quality education that America touts as being part of our democracy. Imagine if every single new teacher in America got this kind of induction, mentored support for 2 years. How the students could actually, the new teachers would be better faster, and the students would actually improve, and the results would be fabulous, and the new teachers would have a fire and a passion for being the best that they can. Imagine how we'd move the needle on performance if we had this kind of a system. Let me just share with you the words of one of the mentees that had a great mentor for 2 years. She said, "My mentor was like a light that guided me through my first years. I was able to take that light and shine it on my students." My heartfelt thanks to the Skoll Foundation and to Jeff Skoll for this award. I accept it on behalf of every teacher in America who's trying to be the best that they possibly can and who care deeply about all students and know that all students can be successful. This award is going to help the New Teacher Center shine that bright light on millions of students, underprivileged students across the country, new teachers, and their mentors to transform education in America. This is our time. Join me in making this difference. Thank you.
Madhav, Chavan, Pratham. Madhav Chavan found Pratham in 1993 to address India's educational crisis. 140 million of the country's children, 95% of whom are enrolled in primary schools, can neither read nor perform mathematics at age or grade appropriate levels. Pratham's approach emphasizes simple, low-cost solutions. It bases its programs in homes and temples. It trains mothers and volunteers to reinforce math and reading instruction and insists on rigorous assessment to ensure interventions succeed. At the height of its flagship Read India campaign, Pratham reached 17% of India's children, covering 21 states and 1 out of every 2 villages. Literacy levels improved dramatically, so much so that the campaign has transitioned to scale up its results through partnership with state and local governments. Beyond its direct interventions and disciplined self-assessment, Pratham created the annual Status of Education Report, the only measurement of children's literacy and numeracy conducted at scale in India today. Madhav and his senior staff serve on educational policy-making bodies at state and central government levels. They innovate and test, implement and prove, and then partner and serve with government to transform public education for India's children. Madhav, Chavan, Pratham.
Thank you, Academy. Always wanted to say that. And there is an aspiring actor inside me, and it helps to know that Jeff Skoll is into movies as well. And I think the Skoll Awards are the Oscars of social enterprise, don't you think? Now, I have a problem, because most of the things that I wanted to say as context to my speech, Sally has already said. So I can tell you some stories instead and some other thoughts. I know Ben is looking forward to those. You see, there are 200 million children in India, 210 million odd children. Sally's given you some statistics. 97% of those, and we verified that through humongous surveys which we do every year, 97% are enrolled in school. Most schools, more than 90% schools, get midday meals. All children are given textbooks, not always on time, but they get textbooks. All children are provided free uniforms, 2 sets. In many states now, the governments are giving bicycles to young girls to go to school. So after all this, and there are teachers as well, not enough always, but there are enough teachers. So why is Pratham doing anything at all? And so when we went out and did this annual status of education report, and we do it every year, we found that 50% of the children cannot read. My colleague, Dr. Rukmini Banerjee, tells a story of a bunch of volunteers going into a village in the northern province of India called Uttar Pradesh. So it's a village, and the village head, a patriarch, is lying down on his charpai. Char is 4, so it's a 4-legger. Can't call it a bed, can't call it a cot. And he's smoking his hookah. And when he sees the volunteers, he's saying, "What are you guys doing here?" They say, "Sir, we are here to do a survey." No. Education is all fine here. All children go to school. And his 3 sons are standing there. One is a 3rd grader, another 5th grader, and a 7th grader, well spaced. And so somebody says, "Look, there's a simple test here," and the young kid starts looking. And so they show it to him, and the 3rd grader stumbles, and he can't read. So the hookah comes out and says, "Okay, give it to the other guy." So the 5th grader starts reading very, very haltingly, can't read. Now the man is sitting up. The 3rd guy, the 7th grader, is saying, "I don't want to take this test." So he says, "Get me my shirt." He's sitting bare-chested. "I want to check every house in this village. What the heck is going on?" And so he goes out and checks, and lo and behold, he finds that most children can't really read. Now, this actually is a picture of India which symbolizes what's going on. Parents think children go to school, so they must be learning. Teachers think children come to school, I teach them, so they must be learning. And the policymakers are happy with all that and say, great. So when we do this survey, village after village after village, it's a wake-up call. Policy is not that easy to change. Establishment doesn't change that easily. Evidence in my corners of the world is not always helpful. So we have to start telling people, simplify the assessment, simplify the methods. So even the most ordinary people who are capable of doing extraordinary things, as we heard, they will get up and say, I want to educate my child. Whose responsibility is it to educate our children? Government. Well, it's easy to point fingers, but as you heard perhaps in your childhood, when you point one finger at somebody, there are 3 fingers pointing at yourself. You better do something about it. Look at it another way. If it was your child who could not read, would you blame the government? Advocacy. Would you go out and lobby, or would you start teaching your child? I think both are required. While you have to tell the government to do things, you have to get up and start doing something by yourself. And I'm proud that I live in the country of Mahatma Gandhi, who said, get up and do it. Do it yourselves. So we The Pratham volunteers, people go out and start talking. Mahatma Gandhi walked 23 days, 300 kilometers, and picked up salt against the British Empire. What country is this now? Okay. Hundreds of thousands joined him, and history of India was changed. And now you don't have to walk for 23 days, not 300 kilometers, just pick up a book, don't pick up salt, and read with a few children in your village. Hundreds of thousands will join you, and the history of India will change once again. It's a very powerful message. And that's how, by the thousands, volunteers come up. Now the problem is, while these volunteers come, they are also victims of the same education system. They can't teach very well. They don't know math. They don't know reading properly. And so the Skoll Award is going to help us to build capacity of our own organization so we can do things not only on a large scale, but do them better. We need to build leadership so that people can do things on their own. I want to end by quoting Lao Tzu, the great Chinese philosopher poet. And it's one of my favorites. It is a guiding principle of how we try to do work. It's not always easy. Lao Tzu said, go to the people, live among them, love them, learn from them, start with what they know, build on what they have, and when it is done, they will say, we did it ourselves. It's not about Pratham, it's not about you, it's not about Skoll. It's about people changing their own lives. We would like to enable them as best as we can. Thank you.
Ned Breslin, Water for People. Despite massive investments by the development community, the world is not on track to meet Millennium Development Goals addressing sanitation and water quality. Globally, 884 million people lack access to clean water and 2.6 billion to sanitation. Working in Africa for 16 years, Ned learned that solutions to sanitation and clean drinking water must be generated and sustained by communities. Water for People puts stakeholders back in charge of their own water systems. Working with communities to design and build systems that provide full coverage, Water for People insists on a standard as simple as it is powerful: to secure safe drinking water and sanitation for every clinic, school, and home in every community. Its newest technological tool, Flow, uses mobile phones equipped with open source software to document working and failed water points, an innovation poised to become a standard assessment tool for the aid community. By 2014, Water for People aims for 100% coverage in 3 of the 11 countries in which it is already active, and it is committed to verifying the sustainability of its solutions 3, 6, and 10 years following their implementation. Ned Breslin, Water for People.
Rain mixes with the distinct smell of burning charcoal, tall grass, and maize stalks that scream Africa with every breath. The Rwandan mountains reach for the sky as thousands gather in the district of Rulindo to say, we are going to eradicate water poverty in our district. Everyone. We're going to get every school. We're going to get every clinic. We're going to get every household. Not this project over that project, Not this community, but not that one. Not this school, but that one's too hard. We're not going to hide behind the facade of demand that is used as a shield by NGOs worldwide to not hear the voices of the hardest to reach, the poorest and most vulnerable. If you listen very carefully, everyone is demanding clean water forever. The mayor, Eustace, is the one who came up with this idea, and he now stands in the rain before residents of Orlando, and he says, I'm in. We succeed if everyone gets water. The government of Paul Kagame is in. Water for People can't help but be in. And the residents of Orlando scream out and shout, filling the air with their roar, putting their money on the table, putting their energy behind this work to say that everyone is going to be served. There are no beneficiaries here. These are active agents of change who want to spark a revolution. We are so honored to be part of this process, but we know we can't do it alone. We feel a wind behind our back, and we now feel the fresh push coming from the Skoll Foundation. We're going to push the frontiers of monitoring and try to give voice to those people, not through the intermediary of some NGO speaking on behalf of them, but let's hear them. Let's hear that roar. Let's get behind it. Everyone. It's powerful. We're going to try and do away with the 60-page reports that nobody reads. That is a justification for funding. That is a way to ask for more funding, but doesn't transform lives. We're going to try to harness the power of visual data, of music, of art to drive this movement forward. And as the crowd begins to disperse, a little girl skips over to me. She's 10 years old. She's beautiful. She reaches out her hand and she says to me, "What is your name?" We chat. She's great. And she skips away. And I know what success is. Success is that we start to hear her voice. That we know that she never has to go to a muddy puddle again to fetch dirty water, but can grow and thrive and be whoever she wants to be. Success is when we take the energy and dynamics of places like Orlando and similar districts in Honduras and Guatemala and Bolivia, and we don't just say, hey, this is a nice little pilot. This is really great, and it's going to be a model in a sea of failure. But it starts to spread, starts to go over. Everyone's in. Why this district and not that district? We can't do it alone, but we can try. Is it bold and ambitious? You bet. Can we do it? I have no idea. But I know we can't do it if we do it ourselves. And I know we can't do it if we don't hear my friend's voice. So, Water for People embraces this challenge on the part of many who are in this fight. Join us. We are excited. We're going to find a way to tell this story. We're going to hear the voices of people. And not only the people of Rwanda or Honduras or India will hold us accountable. Everyone will hold us accountable. Thank you very much.